question number 1.
Okay.
If Ebola is contracted, is there a known scientific measure that predicts recovery or not? And how many days after showing symptoms can you turn it around?
Sure. So it's really important to talk about the clinical progression of Ebola. What we know is if someone contracts Ebola today, meaning if they came into contact with someone which is an Ebola patient, then for 21 days they can manifest symptoms at some time. Sometimes they may not even be infected. But during that 21-day period, the first set of symptoms that people present with is low-grade fever, then it gets to be high-grade fever, then nausea, vomiting, right, headaches. That can happen anytime. Now, when the disease progresses after that, then people have intractable diarrhea and vomiting, and they are highly infectious at that time. Okay. Before they get those symptoms, they are not infectious. Now, in our clinical experience, the earlier we catch patients with Ebola, the faster is their recovery and more likely that they will survive. We know that if we're in that late stage, right, when they're having severe nausea, vomiting, like the first case of Ebola, Eric Duncan, in Dallas, we got him at a later stage of the illness, and that we could not save him. In other cases, like the 2 nurses, we got them at the early stage, and that's why we could save them. So that's the big thing. There's no single test that's a marker that can tell us that we'll be able to save them, but the sooner the better, and we give them the support, which is fluid hydration and the new